Test 1, 2, 3. Recording in progress.
The Insurance Benefits and Rights Committee meeting for Wednesday, December 4th, 2024.
Thank you, Chair Robbins. This meeting is being conducted virtually and in person, so I will do a roll call of the trustees to confirm attendance. Ms. Ginsburg, Mr. Razzo, Ms. Gray, Mr. Rue will be joining us later, Mr. Sanchez, Mr. Oakham,
here,
Mr. Green, Mr. Moore,
here,
Mr. Kehoe,
present.
Mr. Harris, Chair Robbins.
I am here.
Staff participating in the meeting include CEO Santos Kryman, Deputy CEO Louis Lugo, AEOs JJ Popowich and Laura Guglielmo, Chief Counsel Stephen Rice, Legislative Affairs Officer Barry Liu, Director Retiree Healthcare Cassandra Smith, Consultants Stephen Murphy and Michael Zito from Siegel. Trustees, please use the raise your hand Zoom option to be placed in queue. At this time, we ask all meeting participants to mute your mics until you are ready to speak, and we may now proceed with the agenda. There were no requests received for teleconference meeting attendance under AB 2449. Now we're ready.
Thank you very much. The order is out of the way. We don't have any 2449 issues today. Item number 3A, approval of the minutes of the meeting of November 6th. I need a motion.
So moved.
Are there any changes? Seeing none?
Ms. Gray,
Yes.
Mr. Kehoe,
Aye.
Mr. Oakham,
Aye.
Chair Robbins.
All right.
The motion passes unanimously.
Thank you very much. We're on item number 4, public comment. Is there any,
I have nothing.
no requests from the public, either in writing or in person? We'll move right along to reports. Item 5A, engagement report for November. Mr. Liu.
Thank you, Chair Robbins. Good morning, trustees. Some items of interest this month for you. The first item is from the National Institute of Retirement Security about the public perception of public sector pension plans. And overall, it's pretty positive. About 86% of Americans believe that all workers, and not just public sector workers, should have a pension. And this crosses party lines. People think that pensions are effective for recruiting and retention. About 82% feel that benefits are either just about right or maybe even a little too low. The average pension for workers is about $2,400 a month. And then about 3/4 of Americans say that pensions are good for teachers to compensate for lower pay, and that it's good for public workers, public safety workers as well, due to the risk of their jobs. And about 3/4 agree that pensions should be based on employee contributions as well. And so just overall, public sector workers constitute about 13% of the workforce, equivalent to about 20 million workers. The next item is about perception of retirement benefits by workers. So in the 2024 workplace wellness survey, about 62% of workers think that retirement plans are critical to financial security. And about 56% place health insurance at the top of the benefits list. And that makes sense given the fact that, most employees, about 83%, have access to health insurance through their employers. At the same time, though, there's also financial anxiety, given that workers think there might, be looming benefits cuts as well. And although fewer workers use retirement accounts as emergency funds, again, financial anxiety remains with that. So financial education might be, one solution to part of that problem. The next item is about Alaska. So back in 2006, Alaska closed its defined benefit plan. And over the ensuing years, there's been issues with recruitment and retention. So in the last couple of years, there have been discussions to reopen the plan, but it's not a slam dunk. So, there's definitely disagreement amongst the Alaska legislature about this. So this is probably going to affect, the next election, in that there will be support and opposition in terms of campaigning, as far as, which legislators are going to be in favor of opening versus not in favor of opening the plan. So that could determine, the outcome of the next year's legislative races. And then the next item is about auto features in defined benefit plans. So a lot of talk has been over the years has related to whether auto enrollment and auto escalation would help people just save more in defined contribution plans that would nudge them into saving more. And you would think common sense would say that this is effective. But a recent study show that they might not be as effective as we think, especially in the case of auto escalation, because if workers leave a job, they're kind of back to square one again, because they're going back to the default contribution rate, and they might not immediately ratchet that up to what they were at in their old job. And then at the same time, it shows that even with workers within the same job, as the years go on, fewer and fewer, I guess, participate in auto escalation. So they don't stick with those increases in the savings rates. One improvement might be to set a higher default rate, but at the same time, that could affect those lower on the income scale because they have challenges in saving due to their lower income. And then the last item is that time of the year again, where the IRS updates its compensation benefits limits. So for 2025, the 415B, that's the benefit limit, that's increasing from $275,000 to $280,000. And then on the other side of the equation, the compensation limit, the federal limit is being raised from $345,000 to $350,000. And that this only affects our members who began membership after July 1996. Those who began before that date are not subject to this compensation limit. And then we also have our PEPPER members who are subject to a lower limit. So for 2025, for us at least, because we don't participate in Social Security, the limit would be $186,000. So that concludes my report, and happy to take any questions.
Thank you very much. Anybody have any questions for Barry?
What do you know about the government pension offset and the WEP?
So I
The
think
Senate.
well, it's in the Senate right now, but it hasn't been voted on, and I believe our federal lobbyists will give a more detailed report, I think, at a board meeting about that.
Okay.
Thank you very much. Staff activities report, item B.
Good morning, Mr. Chair, members of the committee. On November 8th, CMS finally announced the Medicare Part B premium and deductibles for 2025. We've been working diligently with both Siegel, which we want to thank, as well as Chiron, the county's consultants, in helping us to be able to get this on the agenda for the Board of Supervisors meeting of December 17th for approval in time of our December 31st retirement checks. Staff behind the scenes, we're actually working on preparing our annual notice to go out to members, letting them know this information as well. We've already updated the website to include that. It's going from $174.70 to $185, so it's a $10.30 increase over the last year. In the CEO report, I should say, not my CEO report, but in the CEO report, as well as my staff activity report, I had also reported on a couple of contract negotiations that Anthem is currently going through. I'm happy to report that the Providence contract negotiation has been settled. They've reached an agreement for another multi-year contract. And so that was the bigger impact would have had the bigger impact to our members because of more facilities as well as more providers. So we're happy to say that that's been finalized. The Sutter and Scripps negotiations, I have not heard, so that one is still on schedule. The contract is scheduled to end January 1st, so I will keep the committee abreast as I hear more on that. And that's it.
Thank you very much. Anybody have any questions? That's good. I won't get any more emails from this retiree that lives down in South Orange County that was all up in arms about losing his Providence stuff. So
Yeah.
thank you. LACERA claims experience, item C.
Good morning, trustees. Before we begin, I'd just like to note that the Kaiser exhibit and the prescription drug rebate exhibit remain unchanged from the prior report and will be updated in the future report. This first exhibit contains the premium and enrollment for LACERA's medical, dental, and vision plans. There's been minimal change compared to the prior report. Next exhibit, please. This contains the claims experience for LACERA's non-Medicare plans. So for Anthem's year-over-year trend, 12-month rolling trend represents a 10.7% increase as of October 2024, which is a 1.0 percentage point increase compared to last month's report. For Cigna, the year-over-year 12-month rolling trend represents a 19% increase as of October 2024, which is a 4.9% percentage point decrease from last month's report. And Kaiser's claims experience remains unchanged. Next exhibit, please. This contains the Anthem claims experience on an aggregate basis and split by plan. So for all plans, the year-over-year 12-month rolling trend represents an 8.7% increase as of October 2024, which remains unchanged from the last month report. For plans 1 and 2, the year-over-year 12-month rolling trend represents a 10.5% increase through October 24, which is a 0.9 percentage point increase from last month's report. Prudent Buyers year-over-year rolling trend represents a 10.2% increase as of October 24, which is a 0.8 percentage point increase compared to the prior month's report. And for Plan 3, which is the Medicare Supplement Plan, the year-over-year 12-month rolling trend increase is a 7.5% increase as of October 24.
Is this a usage increase or is this?
Claims experience. So this
But
is.
no, I understand that, but is that more claims or more charges by doctors?
Just more claims.
More claims. Has nothing to do with charges by doctors.
Clarify, it's likely a combination of both increased utilization, but also increased fees.
Okay, what do you think the increased utilization is? I mean, roughly 70%?
I think basically what we're seeing is most of it is on the fee side. So utilization is probably pretty steady, but I think we're seeing it tipping towards increased fees at this point in time.
Thank you.
Next slide.
Next slide, please. Next slide, please. This exhibit contains the large claimant experience for Anthem, Cigna, and Kaiser. For Anthem's non-Medicare plans, the 12-month rolling trend as of October 2024 is a 100% increase compared to the prior period. This is due to the increase in the number of individuals exceeding the polling point, increasing from 10 individuals in the prior period to 23 individuals in the current period. The aggregate claims in excess of the polling point increased from $1.7 million in the prior period to $3.5 million in the current period. For Cigna, the 12-month rolling trend represents a 62.3% increase compared to the prior period. This plan is subject to a fluctuation due to a small and mature population. Likewise, the claims volatility is also due to a lower polling threshold of $100,000, with one person exceeding almost $1 million in claims. And Kaiser's experience remains unchanged from the prior report. Next exhibit, please. This contains Anthem's lifetime maximum benefit. So we're tracking the individuals at risk that are reaching $1 million. At the bottom left and right table contains the September 24 and October 24 counts. So the counts from September 24 to October 24 increased from 202 individuals to 206 individuals. Next exhibit, please. Next exhibit, please. This exhibit contains a dental and vision claims experience. Cigna's dental claims trend on a rolling 12-month basis increased by 3.5%, which is a 1.9 percentage point decrease from last month's report. And Cigna's vision claims trend on a rolling 12-month basis increased by 7.5%, which is a 0.5 percentage point decrease compared to the prior month report. Thank you. And I'd like to note that LACERA staff and Siegel are going to work with carriers, are going to meet with the carriers on January 7th, 2025 to finalize any details for the renewal.
Anyone have any questions?
I do want to also inform you that on November 26th, the Board of Supervisors did approve for us to increase the 1 million to 1.5. That will be effective July 1st with our 2025-2026 premium costs. over the next year or so, we're going to also be monitoring and reporting quarterly to the board or to the CEO what any migration factors are to alleviate them of their concerns of everyone moving over from Kaiser to Anthem. That's it.
Okey dokey. Good news. We like good news. Item D, federal legislation,
I will note that we've,
hornet's nest.
no, we've included a couple of compliance news updates in your materials, but we'll defer to the board presentation later this morning for a little deeper look. But we have 3 items. One, proposed rules to expand Affordable Care Act contraceptive mandate. So just providing improved access nationally is the intent there. That may or may not pass. The next item is new standards for mental health parity under the new MHPA rules. That will proceed, I think, without any issues. And then lastly, we have some new guidance on preventive services that cut across a variety of areas, including coverage for HIV PrEP or preventive services, coding requirements for preventive services, and then the scope of breast reconstruction surgery has been expanded to be a little more complete and thorough in terms of members requiring those types of services. So with that, I will conclude my remarks and take any questions.
Any questions for Steve? Seeing none, hearing none. Items for staff review.
I have nothing.
We have nothing. Items for future agendas.
I have nothing.
Nothing. Good of the order, we'll just wait until the regular board meeting. And if no one has anything, motion to adjourn. We are adjourned.
Recording stopped.